Red2Green, as you know, is a concept about how we start valuing patients' time and getting rid of unnecessary waiting in hospitals. And it's crucial that clinicians lead on this because they're the champions of patients' time and helping them to get better, faster and safer. There are some really good examples out there. So if you go to Ipswich, for instance, it's the consultant body who really drive the Red2Green agenda there, really focusing on getting rid of unnecessary waiting in their patients' journeys. And
Red2Green for me is about valuing patients' time. It's about a to-do list for every patient every day. They start red and they don't go green again until every single thing on that to-do list is ticked off. Even it's not about the scan being ordered, it's about the scan being done, reported and someone acted on the result, as an example. It's about getting people home so they can spend time with their loved one, with their family in their house.
The benefits to our patients are that they are not in hospital for longer than they need to be. And the benefits for the staff is that they're focused in the work that they do, supporting patients to be discharged in a timely manner. And the cultural shift is that they absolutely love it.
Red2Green, from my point of view, has two functions. The first is about changing the way we think about things, about not tolerating the waiting and not tolerating inefficiency in the system and demanding a better journey for our patients with better outcomes. And the second bit about Red2Green is really about collecting what all the barriers are in the system and using that evidence to change the systems to make it easier for us all to give better care to our patients.
Red2Green Day is important for us because it highlights constraints that we have in the system and it gives us the power to challenge those constraints. So for example, if it's a CT scan escalating, why is this person not gone for a scan? And if there's something that we can do about it, for example physically taking the patient down for that scan, then we can get that done. It also means that we have the power to tell that patient why they're still in hospital.
What a great day. We've heard from some great trusts. Too many to mention individually. Key messages though, what works is when the mindset's right, where people believe they can, people test things out, people give things a go. Some great examples of non-acute Red2Green from community hospitals, which have showed a reduction in bed occupancy, from care homes with some phenomenal stories of patients who are deemed to have no rehab potential, who now are living decent lives. So key messages is, give it a go. Think about patients' time as the most important currency in healthcare. A green day is a day when everything should happen for a patient, and it does happen. A red day is when not everything happens.